hello, anyone who's joining. Just give it another couple of minutes so that we start at 8. Sorry that I just put it on a blank wall. I was just leaving it so that people could join and then we could get going. I'll show you my phone here so I can check the time. Hello, anyone. Thank you for joining. Feel free to say hi in the comments. And if you've got any questions too, hi, hello, hi from New York, hello. If you've got any questions, I will try and get to them, but this is more sort of lecture style. So I have kind of planned everything that I'm going to say and the contents of it. So if I don't get around to questions, I'm really sorry, but I'll let you know how you can get those answered. But yeah, so it's 8 o'clock. Let's make a start. Cool. So first thing I wanted to say to you is that for watching this video and being part of the masterclass, we are offering you 15% off any of our packs, which is amazing news. So if you've been thinking of getting one of the hypnobirthing packs or pregnancy packs or anything from the Positive Birth Company, then now's the time to buy because we've got 15% off. It's a special code just for you guys, and it expires in 24 hours. It's pregnancy 15, pregnancy in capitals 15. So if you wanted one of the packs, now's a great time to buy them. I'll remind everyone at the end as well, just in case you forget. So I'm just going to go through the contents of this. So this is a masterclass on the first trimester, early pregnancy, and some of the things that go along with that. So I'm going to talk about, just so that you know whether the video is going to be suitable for you or not, early signs of pregnancy. Am I pregnant and what's going on? What to do after you get a positive test, when you'll hear from the midwife, your booking appointment and everything that entails, your ongoing plan of care and when you're likely to be seen in your pregnancy, your first scan and what's involved, along with screening tests, Down syndrome, Edwards-Hillard, troubleshooting, sickness, tiredness, mood swings. And then if we've got time, I've just gone into things that you can eat and can't eat during pregnancy, just to cover dietary stuff a little bit as well. But we'll see how we go and if there's time to fit it all in. So just to introduce myself, now you know everything that's happening in the video. I'm Christie. I'm one of the midwives for the Positive Birth Company. It's a fab company. I love working for them. It's an absolute honour. So thank you for joining me on this video, and let's get stuck into it. So firstly, am I pregnant? Sorry, I do have notes, so just bear with me if I'm looking down. So firstly, am I pregnant? What are the early signs of being pregnant? I absolutely love this topic because it just resonates really well with me, and I find it really nice to talk to people about their early signs and symptoms of pregnancy. It's always a really interesting one, and weird and wonderful things can happen to people in these early stages of pregnancy. You can get some really strange symptoms, so I always find it quite a fun one. I'm going to go through the most common symptoms, but it's absolutely not an exhaustive list. So if you're thinking that you might be pregnant, these are some things to look out for. Firstly, this is obvious, but a missed period. It can be quite tricky if you've got really irregular periods. So I advise massively using a tracking app for your periods. It can really, really, really help you know exactly what's going on for your body to see if there is any sort of pattern, regularity, when you might be ovulating. And it looks at all of those things, and you can track like loads of stuff on it. You can track when you've had unprotected sex, you can track what your discharge is like, you can track all of that. So it can be really helpful if you're trying to get pregnant, or if you're unsure whether you might be pregnant, to have an app so that you can kind of look at the markers of that and see if you might have missed a period, if your periods are really irregular. But yeah, obviously a missed period is a telltale sign. An implantation bleed. So this is usually much lighter than a period. I think that some people wonder whether it's an implantation bleed or a period, but an implantation bleed is when the fertilized egg and sperm find their little place in the uterus, and they're like, no, this is it, this is the place that we want to be, we're going to burrow in here and your placenta starts to grow from there. So when that happens and it burrows in, you get an implantation bleed, and that tends to be like a brownie discharge, sort of like towards the end of your period or the very start of your period. When you get that kind of brownie discharge, that's what an implantation bleed tends to look like, rather than that fresh red bleeding. It can be around the time of your period, so you can think like, oh, I've just had a weird small bit of spotting this time, but that might be a sign of an implantation bleed. Cramping. Now, this is a really interesting one. So it's really normal to get a cramping sensation almost the same as your period at the point that your period's due. And that can be really confusing, because you're like, am I coming on? Is this just period type symptoms, or is it not? And it can also be quite nerve-wracking, particularly if you have managed to have an early positive test and then you get the cramping a few days later. That can be a little bit scary. But cramping in the absence of bleeding is actually a really positive thing if you're looking for signs of early pregnancy. So if you're cramping but there's no bleeding, that's a likely sign that things are happening for you, and that baby is getting all cozy in uterus. So breast changes. This is a good one, because a lot of people say that this is like the first sign that they had that they were pregnant. You can let me know in the comments if you guys had this as your first sign when you were pregnant. But tender boobs tends to be like the one for people. They get tender boobs and they're like, I know I'm pregnant. It's sort of usually around the edges, sort of down here under your armpits. That's where people tend to feel that sort of tender boob sensation. And it can be similar to when you're on your period, but also can be slightly more intense. So you might be feeling slightly more tender boobs than you get with a period, and that's another telltale sign. Also changes in nipple color, slight boob swelling, and more visible veins are all signs that you might be pregnant, you might be expecting. Nausea and sickness. Now, this one is, you probably have already had a positive test, so you might already know that you're pregnant by the time that this happens. This is usually around 4 to 6 weeks. So you might have had the positive test and then be like, I actually am fairly symptomless. This is going pretty well so far for me. And then the nausea might kick in a week or two later. So it's really common. It happens in a lot of pregnancies. It's obviously called morning sickness, but can happen any time or day. The one thing that I find the biggest help really is eating little and often, but I do have a troubleshooting section on nausea and vomiting, so we'll go into lots of other ways that we can help with that. Mood swings. So again, these can be really, really common. You have an absolute influx of hormones in those early parts of pregnancy. Estrogen, progesterone absolutely skyrocket, and they need to do that to protect the pregnancy and to help a healthy pregnancy and baby develop. So it's necessary, but it comes with some potentially unwanted side effects in the form of mood swings, and it can be quite normal to be quite tearful, quite easily irritated, quite angry, maybe sometimes aimed at your partner. Not ideal, but it's completely a normal part of pregnancy. Once your body adapts to that surge of hormones and it gets used to the fact that there's an extra level of estrogen and progesterone, your mood swings should start to calm down. Skin and hair changes. Acne, oily skin, dry skin. I suppose they're pretty self-explanatory, but these can actually happen quite early. So you might think, oh, my hair is just getting a little bit more greasy than it normally does. And that can even be before a positive pregnancy test. So again, that's another telltale sign. Tiredness, obviously, again, really, really common. A lot of people feel really, really tired, particularly in the first trimester. The only thing that I can suggest is rest. It's the only thing to do to help with tiredness. Feeling dizzy is another one. Some people feel quite fainty, even if they've not been that type of person usually, and they've not had any episodes of fainting or feeling lightheaded for a long time. Pregnancy, your circulatory system changes massively when you're pregnant. So you have to take on a lot more blood flow. Your arteries and veins dilate a bit so that you can process that extra blood, and so that can have an effect of your blood pressure dropping, and that can make you feel a little bit faint, and that all happens really, really quickly. Like as soon as your placenta basically embeds, you start a circulatory system to your baby, and your whole circulatory system has to change, so it's quite normal to feel a bit dizzy and faint. But early on in the pregnancy, we do also check your iron level in case you have a history of anemia or in case you become anemic in the pregnancy, to make sure that we can give you iron supplements to keep that level up, and that can help with you feeling dizzy and faint. Having a strange taste in your mouth. So people often say this is like a not very nice metallic taste. Sometimes get it even more with hot drinks. And that can be a telltale sign that you're pregnant, along with strange cravings. I love the cravings one. It's one of my absolute favorites. I've had people coming to antenatal clinic before eating chalk, coal, wall plaster, like all manner of crazy things that your body makes you crave when you're pregnant. So that might be another telltale sign for you. Constipation and frequent weeing. So your kidney, so with that extra blood volume that you take on to maintain the pregnancy, your kidneys then have to filter all of that extra blood, and in doing that, that makes you wee more, if that makes sense. So to support your baby, you then have two circulatory systems. You have your own and your baby's, and all of the blood that's got all of the rubbish in it from you and your baby then goes through your kidneys, and you have to basically wee for yourself and your baby and filter all of that blood. So that's why you're weeing more. Also, the hormones can make your bowel kind of slow and sluggish, and that can lead to constipation. So again, these are all telltale signs. If you're experiencing any of these, you may well be pregnant. A heightened sense of smell. This is my absolute most favorite because it's really resonates with me. So probably, like, honestly, this sounds crazy, but like 3 days after conception, I would say, with both of my sons, my sense of smell has been really heightened, and to be honest, everything smelled a bit like gone off and not very nice, which is not ideal. But I've really noticed things smelling really quite strong, and that definitely the second time around. Like the first time I didn't really register it, but the second time around I was like, oh, I think I'm probably pregnant because everything smells really horrible. So yeah, that can be another really real telltale sign, and like I said, it can be super early that you experience that. Again, and the last one that I've got is an increase in vaginal discharge. So this should be white, milky, creamy kind of discharge, and non-offensive smelling. If it smells offensive or is like greeny or an unusual color, that might be a sign of you having an STI. But if it's normal, white, milky, creamy, kind of clear, non-offensive smelling discharge, then you might have an increase in that. And again, that's another sign. So there's a load of the most common signs and symptoms of pregnancy. So if you're experiencing any of those, you may well be pregnant. But it's also important for me to tell you that some people have no signs and symptoms, and that's completely normal too. And that can be quite stressful, particularly if you've been trying for a long time, if you've undergone any fertility treatment and you're having no signs and symptoms. But that is completely normal as well. So you might be experiencing the whole list. I hope you're not, but you might be, or you might be experiencing nothing. All of that is completely normal and absolutely fine. So that's the most common things. It's absolutely not an exhaustive list. So you might be having some other weird, wacky symptoms of pregnancy. If you've got anything absolutely crazy, please pop it in the comments, because I always love hearing them. And yeah, that's it in terms of early pregnancy signs and symptoms. The last thing to say on that note is, if in very early pregnancy you have any concerns and feel like you need to talk to anyone, sort of between 2 and 10 weeks, your GP is your first port of call there, and then you start to hear from your midwife. So if there's anything between like 2 and 10 weeks, GP, and that's even if you are bleeding and need to be seen by the early pregnancy assessment unit at the hospital, the referral process is by the GP. So usually you have to go to them first. Cool, so that wraps up that. Next, what do I do after a positive test? So you've had all of the signs and symptoms, hopefully not some of the signs and symptoms, maybe none, and you're at the point that you've had a positive test. What do we do next? So there's a couple of things. Things have changed slightly very recently, and that is in terms of self-referral. So you may be under a team, a hospital, where you're able to self-refer into the midwifery service. If you don't know whether you can self-refer in or not, or how it works, you contact the GP. And the GP will then either book you an appointment and say, come on in, let's discuss and make a plan, or they say you can self-refer via this link or portal, or this is the way to do it. So there's two things that you need to do once you've had that positive test. You need to contact the GP, and you either need to self-refer into the midwives or go to the GP, have an appointment with them, and they do the referral for you. So it just depends on where you are and how it works locally for you. You have sort of a week or two after your positive pregnancy test to just bask in the joy of finding out that you're pregnant, before you have to do this and take the next step. So really we want you to be in contact with your GP between sort of 5 and 7 weeks so that they can then start the process of care onwards from there. So have that positive pregnancy test, have a week to indulge in it, then get onto your GP and start the referral process. So if you go to the GP, they will likely either retest your urine or just take your word for it that you're pregnant and it's absolutely fine. Different GPs do different things. Some people will just be like, yeah, that's fine, you've had a positive test. They will then say, they'll then take a brief history. So they'll take like an obstetric history, if you've had any babies before, a medical history from you, potentially a social history, if there's anything to note there, and that, yeah, and any allergies and stuff like that. They then put that on a form and send that through to the midwives so that the midwives can contact you. And what they will also ask at that appointment is which hospital you would like to book at. Now, this can be quite tricky because you're quite early on in your pregnancy at this point, and you don't really know like where you want to book and what you even want. It's quite early to make this decision, and that can be quite hard. You can transfer hospitals in the pregnancy. So if you choose one and then change your mind, don't worry, that's fine. Some places just have a one local hospital. It really depends where you are in the country. You might only be under the catchment area of one hospital, but you might be under the catchment area of 3 hospitals. And if that is the case for you, then your GP will say which of these hospitals do you want to book at. Booking at a hospital means that you'll get all of your antenatal care through that hospital. So all of your midwife appointments, your midwife will be linked to that hospital. Your birth would be at that hospital or a home birth linked to that hospital, and your postnatal care would be provided by them too. So once you're booked at a hospital, your care is taken over by them and they look after you. So things that you might want to consider when you're choosing which hospital to book at, if you're in the catchment area for several, is to think about what word of mouth says about that hospital and what reviews online, like even Google reviews, say about that hospital. That can be quite helpful if you've had any friends or anything that have had babies there, what they say, if they felt that the care was good. Also looking at the CQC reports. So you can just Google CQC online and find CQC reports for your local hospital, and that will give a breakdown of their maternity services. And it's an independent assessor, sort of like Ofsted is for schools. So CQC will have gone in and assessed the maternity services at the hospital that you're thinking of. So you can have a look, and they give a rating, sort of like schools with, good and excellent and stuff as well. So you can have a look at that and the CQC ratings for all of the hospitals that you're in the catchment area for. That might help, along with word of mouth. And the other thing that I was going to say was, what facilities do they have available at that hospital? So do they have a home birth service? Do they have a delivery suite? I'm sure they will have a delivery suite. Do they have a midwifery-led unit? Is it an alongside midwifery-led unit? Is it in a separate area attached to it? Thinking about what facilities you want available for you for the birth are helpful to think about even as early as 5 weeks, so that when you book at the hospital, you are booking at a unit that has the potential facilities that you want to use if you're thinking particularly of having something like a home birth or a water birth on a midwifery unit that's not attached to the hospital. So have a think about those things. Sorry. If you can, before your booking appointment, so that you can choose the hospital that you want to book at effectively. Cool. Hopefully that covers what to do next in terms of going to the GP, getting the referral through to the hospital, getting yourself booked into a hospital, and starting the process and the ball rolling of your care. So once your referral has been sent, either your self-referral or your referral by your GP, that will then go into the booking office. Your bed will be booked at the hospital, your place will be reserved, and that will then be forwarded to your community midwife teams. And then your community midwife will contact you. They will be your named midwife throughout your pregnancy, and you will meet them for your booking appointment. So your booking appointment is at about 10-ish weeks, somewhere around there, somewhere between sort of 8 and 11. Usually you have your booking appointment. Now, this is a really long appointment. It takes about an hour. And it can vary where it is. It could be at the GP surgery, a children's centre, the hospital itself. It might be at your home. It might be over the phone. everyone does this very, very differently. So your midwife will let you know when your booking appointment is and where it is and that kind of stuff. But the content of them is pretty similar. So in terms of content, like I said, it takes about an hour, and we basically are information gathering to learn as much about you as we possibly can. We want to know your ethnic background, your culture, your social history, your medical history, any obstetric history, any gynecological history, any substance use, any of that stuff. We ask a lot of questions. So be prepared for the fact that you're going to have to lay a lot on the line at this appointment. And the reason that we have to ask so much is to provide a really comprehensive plan of care for your pregnancy. So at this point is when we decide whether it's a high risk pregnancy, whether it's a low risk pregnancy, what kind of pathway of care you're going to follow, if you need any additional appointments, scans, tests, if you need to be referred to any other services. All of this stuff is decided as early as between 8 and 11 weeks. It can change if stuff changes in your pregnancy, and you can be low risk and then transfer to high risk if something changes and happens. But it tends to be that at this really early point, we decide which pathway you're likely to follow and what additional tests and things you need and what needs to be put in place for you. So that's kind of the point of the booking appointment. We get a huge background from you and make an ongoing plan of your care. There's also a lot of discussion at this appointment. So we information gather, we plan your pregnancy and how it's all going to look. And then we also talk to you about how your baby develops during pregnancy, diet, exercise, foods to avoid, foods that you can eat, pelvic floor exercises, your antenatal care pathway and how that might look. Also, we already talk about infant feeding at this point, so breastfeeding, bottle feeding, what your thoughts might be on that. Antenatal classes, the availability of those locally, what's at the hospital. In fact, this is something that I would really, really look at, even super early in your pregnancy, as early as the first trimester, is what pregnancy classes your hospital provides, because these can get booked up really, really quickly. So, for example, where I work, we do have a free hypnobirthing class. It's not the same as doing all of the stuff in the Positive Birth Company, because you get so much more information from doing the course with the PBC. But there's a sort of, I don't know, quick overview sort of hour session of free hypnobirthing from the hospital. So that might be one that you sign up for. They tend to go really, really quickly. And yeah, some of the antenatal classes that are on there go also really, really fast. Some hospitals even do provide free pregnancy yoga and free exercise classes. So I would look at those super early just to see if there's any that you think that you might want to do, and be mindful of the fact that they might book up so that you can get yourself onto those nice and early. They're also likely to talk to you about the benefits that you can get when you're pregnant, free prescriptions, free dental care, talk about and sign your maternity exemption certificate so that you can get those. They might also talk to you about Healthy Start and the availability of free fruit and veg, and also options of where to have your baby. Finally, they'll talk to you about car safety, travel safety, and also what scans and tests you might be offered in your pregnancy, along with how to access your maternity notes so that you can look on the system, see everything that's been documented by the midwife, see any future appointments, and really make a plan for yourself and see how it's all going to go on the app. So it's usually an app. Some places are still on paper notes, but not very many. So you should also get access to that during that time. Just gonna have a quick break, catch my breath. Sorry, I'm a really fast talker, but there also is quite a lot to say. I'm mindful that this is only supposed to be 30 to 45 minutes, and there's quite a lot to get through. So next, this sometimes happens at your booking appointment, but sometimes happens at your scan. So don't worry if they don't do this at booking, they will do it at your scan, but it will be done at one of those appointments. And that is, your height will be checked, your weight will be checked. And there's two reasons for that, really. The first one is to calculate your BMI so that we know the plan of care for your pregnancy. For example, if your BMI is over 35, that might change the pathway of your care and the trajectory of your pregnancy going forwards. But also the reason that we need to do that is to create your customized growth chart. So we make a growth chart based on your height, weight, BMI, ethnicity, any weight and size of any previous children, and all of that stuff all goes into a customized growth chart and makes a chart just for you that's going to show how big we're expecting your baby to be and the parameters in which we're expecting your baby's growth to plot along the course of your pregnancy. We really need your height and weight to be able to make that chart. So that's why we do that at the scan or at the booking appointment, so that we're able to make that customized growth chart. We don't actually start plotting baby's weight until you're 28 weeks. So you've got a little way to go, but we need to make the chart early so that we've got it there and that we've got your BMI right from the start of the pregnancy. We're also likely to do a baseline set of observations. So blood pressure, pulse, potentially temperature, just so that we've got it all, so that we know what your sort of resting set of observations is, just in case anything changes in the pregnancy. We can look back and say, right, when they booked, their blood pressure was 100/60, but now it's 140/90, and there's been a really significant jump. So we like to take a baseline set of observations either at booking or at your first scan as well, so that we've got that as kind of a basis for going forward and looking back at where you were at the start. We'll also send off a urine sample to make sure that there's no UTIs there. If you're symptomatic of a UTI, that's one thing. Any burning, stinging, anything like that when you go to the toilet. Urinary frequency, which I know can be quite tricky because obviously you're pregnant and probably going to the toilet quite a lot, and that sort of irritated bladder feeling. So if you have signs and symptoms, then we will absolutely send a urine sample, but we will send it anyway, just in case you have a urine infection and you don't know about it. And again, just to get a baseline to make sure that there's nothing unusual going on with your wee. So we'll send that at the first scan or booking appointment as well. And then we'll also do some blood tests. So these cover a few things. As I said earlier, your iron level, we check that right at the start to just make sure that you're not anemic and that you don't need any iron supplementation. We check your blood group just in case at any point you might need any blood during the pregnancy, so that we know what to give you. We check if there's any abnormal antibodies in your blood, which is a bit confusing, and I'm not going to go into all of the details of that now, but you can get sort of variations and abnormal antibodies in your blood that require treatment and care throughout pregnancy. So we're also checking for them. We offer screening for HIV, hepatitis B, and syphilis. So all those 3 infectious diseases, because we know that they can have an effect on baby. And dependent on your ethnicity, and if you're more predisposed to get them, we might test you for sickle cell and thalassemia as well. They're all offered tests. You can decline one of them, you can decline all of them. It's totally up to you. But those are the blood tests that we're doing at around 12 weeks when you have your first scan or in your first booking appointment, to go forward in your pregnancy and just know those kind of parameters and what's going on with your body. And if there's anything to note, any sort of, any sickle cell, any thalassemia, any HIV, anything like that. So that's what we're screening for on you. Those tests will be offered to you. Then the other thing that we might take blood for is definitely at your scan rather than your booking appointment, and that is for Downs, Edwards, and Patel's syndrome. So they all come sort of together in one test, but you can separate them if you want to. So say you wanted to accept testing for Down syndrome, but you didn't want to accept testing for Edwards and Patel's, or you wanted to accept testing for Edwards and Patel's, but not for Downs, that's fine. You can, consent to one test and not all 3, or you can consent to all 3, but we will offer you testing for all 3 of those at your booking appointment. And then they will be done at your scan. And the reason that it's done at your scan is because it's called a combined test, and we can combine the factors in your blood along with the measurement of the back of baby's neck. So we measure the fluid on the back of their neck, and that gives us an indicator as to the likelihood of your baby having one of those conditions. That is, I think, just for Downs, and it's the blood test that's for Edwards and Patel's, but that gives us the measurement of the back of the neck, and the blood test gives us a combined result to say whether you are likely to have a baby with Downs or not likely, and we categorize that particularly. So we will say you have a 1 in 600 risk of having a baby with Downs, or you have a 1 in 50,000 risk of having a baby with Downs, and that can make you decide whether you need further testing. So if it's a 1 in 250 or more chance, if that makes sense, then you will be offered further testing such as amniocentesis or chronic villus sampling, so that you can get a definite decision as to whether your baby has Downs. You can get a definite answer to say, yes, they do have one of these three syndromes, or no, they don't. And so you'll be counselled on having that test if you get to that point. But just so that you know, you will be offered that screening for Edwards, Downs and Patels, and it's a blood test combined with the nuchal fold that will happen at your scan. The other things that happen at your scan, so your first scan is called your dating scan. It happens between 10 weeks and 14 weeks. It's called your dating scan because what we plan to do at this scan is make your estimated date of delivery, your EDD, your due date. That's what we are trying to decipher from this scan. So what we're looking at is how big your baby is already, when we think they're likely to be due, and we will give you a due date at this appointment, checking that there's just one baby in there and not 7. That your baby's growing in the right place, that it's not ectopic, that your baby's in your uterus and where it should be. And we can also see some parameters of development at this scan as well. So it's really the 20-week scan that's the anomaly scan that gives you a full look at baby's brain, heart, liver, kidneys, all of that kind of stuff. That's the 20-week scan where we're looking for more significant conditions. However, some things like severe spina bifida can be picked up as early as 12 weeks, just so that you're aware. And that is your dating scan. So we're sort of up to like 12 weeks of pregnancy now. I think I have talked about, yes, I've talked about that. Sorry, just checking that I talked about everything to do with Downs, Edwards and Patels. So that's kind of up to the 12-week mark, which is almost the end of the first trimester. And going on from here, I just want to talk about what your care is likely to look like following the end of the first trimester. So this is when you're likely to be seen by your midwife and or doctor, depending on if your care is shared. So if it's at your booking appointment, we say, oh, it seems like it's a high-risk pregnancy because you have these pre-existing medical conditions. Then at these junctures and when these appointments are, you may see a doctor, you may see a midwife. It just depends on who's caring for you and how your pathway of care is. But these are the junctures that you'll be seen at. So first baby, you have your booking appointment, your dating scan, a 16-week appointment, your 20-week anomaly scan, a 25-week appointment, a 28-week appointment, a 31, 34, 36, 38, 40, and 41. So that's when you can be expected to be seen throughout the course of your first pregnancy. If it's a second pregnancy, there's a few less appointments. Just because you've done it before, we need to touch base a little bit less. And so you have your booking appointment, dating scan, 16 weeks, 20-week anomaly scan, 28 weeks, 34, 36, 38, and 41. So you get 7 appointments, second baby, 10 appointments, first baby. So those are the junctures that you're likely to be seen at, just so you know the pathway of your care through your pregnancy. You may be offered additional things dependent on what's going on with you. So you might be offered a glucose tolerance test at 26 weeks. You might be offered growth scans. You might be offered further things. So you might have appointments additional to this, but these are the junctures at which you should be seeing a doctor or midwife and touching base to have your blood pressure checked, your urine checked, making sure that you're well, baby movements, have a listen into baby, all of those things. And then let's head on quickly to troubleshooting. So firstly, nausea and vomiting. I get this question a lot, and it's really hard because I think if you're in severe like nausea and vomiting phase, you're probably not going to want to hear anything that I have to say, because you can get to a point where almost nothing helps. But these are the suggestions that I do have. So firstly, and the people who are really struggling are going to hate me for saying this, but ginger. And I'm not saying like ginger biscuits and anything else, but ginger, raw ginger, ginger tea, things like that. We know that ginger is an anti-sickness, so it has the potential to help. I know that it's really annoying to hear over and over again, but as a very first line, if you're feeling slightly nauseous, ginger might help you. Eating little and often can really be a game changer. I think I didn't really grasp this during my first pregnancy, that I really needed to eat very regularly and consequently was very like nauseous and sick a lot of the time. But if you can eat little and often, it really can make a massive difference to your nausea. Essential oils can be really helpful as well. Peppermint can be good. Some people do struggle. and have sort of an adverse reaction to peppermint and don't love it. But the one that I find the absolute best is lemon. And that can even be if you're really struggling from like hyperemesis or really struggling with sickness generally. You having a lemon oil in a diffuser or having it on like a cotton wool ball and just smelling it can really just take the nausea and the feeling of sickness away. It's not to say that you're not going to be sick and the nausea is not going to come back, but it can just help for temporary relief. In terms of complementary therapies to help you with nausea and vomiting, acupuncture can be really helpful. Reflexology and aromatherapy are all really good things to try if you're wanting to try something more natural before going on to any medication. And that brings me to say that if you are really struggling and you think that you need to be medicated, you can go to the GP and ask for antiemetics, which are anti-sickness medications. The first line is usually cyclazine, and you can have that a couple of times a day if that is required. And if that's not working for you, you can have another one, and then there's another one to try as well. So there's kind of you can go through the process if the first one's not working to get something that might work for you. If none of that is working and you're really struggling and you can't keep anything down and you're struggling to keep fluids down and you think you're becoming dehydrated, you need to go to the early pregnancy assessment unit, and that might be via a referral through your GP so that you can have intravenous fluids and maybe have some even stronger anti-sickness medication. Hopefully you don't get to that point, but I just wanted to tell you where all of the huge spectrum of nausea and vomiting, from ginger being helpful and lemon oil to needing, admission to hospital. In terms of emotions, it can be a really tricky time. You do have a massive increase in your hormones at this point, and it's completely out of your control. And the downside of having loads of estrogen and progesterone, which are great because they're protecting your pregnancy, can make you a little bit irrational, mood swingy, very sensitive, very irritable. These are all quite normal feelings. Just in case you are experiencing any of those and you're really struggling with the fact that you are feeling like that and that you're not feeling like your normal self and that you're being quite grumpy or moody, it's really normal, and everybody can experience that usually at some point in their pregnancy, but it's really common in the first trimester. I said this earlier, but once your body has adapted to the influx of hormones, hopefully the mood swings will start to cease. However, some people do have them throughout the pregnancy, and obviously we all have them from time to time. Feeling anxious, vulnerable, and overwhelmed can also be really normal signs and symptoms of pregnancy, but it's just monitoring that and making sure that you're at a point where you think that this is normal. And the person that's most likely to notice is a close family member, partner, or someone else with you, if it seems like it's more than this. And if it is, and you're really struggling emotionally, then referral via the GP or the midwife. We can help you with where to be signposted there so that we can get you help and support in your pregnancy. It is quite normal to feel down and feel very emotional, particularly in the first trimester, and not necessarily, particularly as well if you're having a lot of the pregnancy symptoms, and not necessarily feel all singing, all dancing, super buzzing and happy about your pregnancy all the time. It is really normal. So just in case you needed to hear that, I wanted to put that out there on this video. But if you think that it's more than what might be normal, then absolutely contact your GP or midwife and look into a referral from there. Also, things that can really help, obviously it's very easy to say, but diet, exercise, and sleep are also important to like positive outlook. So if you can be really well rested, try to eat a healthy diet, although it's not always easy in the first trimester, and try and do some exercise. That can really help you to get in a positive place if you are really struggling, can really help to improve your mood. In terms of tiredness, the only answer is rest. Hormonal changes make you tired. I personally think that it's a whole other level of pregnancy tiredness. It's like absolute exhaustion. Definitely worse than newborn, awake in the middle of the night tiredness, in my opinion. So yeah, you just have to rest as much as you possibly can and make sure that everybody around you is supporting you and helping you to rest as well. Cool. Right, that's it for what I said I was going to talk about. I do have foods to avoid in pregnancy as well, but I'm conscious that we're getting towards the end of the session. One thing that I will say is super helpful. Let me just find it on here. So if you go to keeping well in pregnancy on the NHS. So if you type in NHS keeping well in pregnancy, it will bring up their sort of backlog of information, and that is what midwives work from, what other health professionals work from, health visitors, any sort of antenatal classes that you might have, where a lot of the up-to-date information is through the NHS website. So it can be really helpful. And on there, I'm just going to run through the list so you know everything that's on there, so that you know if it's a good place to look. Diet in pregnancy, if you're vegetarian or vegan, and trying to support a pregnancy on a vegetarian or vegan diet, there's information on that on there, which can be super helpful. Foods to avoid in pregnancy, and it's so good. It doesn't just say like avoid this and avoid this. It says what to definitely avoid, what to be careful with, what you can eat. Like, it's really, really helpful. It's really thorough. So if you're worrying about eating the NHS and what to eat in pregnancy and what to avoid, the NHS website is amazing for that. Vitamins, supplements, and nutrition in pregnancy, exercise, medicines, mental health, depression, sex, travel, work in pregnancy, baby movements, reducing the risk of stillbirth, alcohol in pregnancy, smoking in pregnancy, illegal drugs, vaccinations, flu jab, whooping cough, infections, and COVID. So they have really helpful information on all of those topics. So if you just type NHS keeping well in pregnancy, then all of that will come up, and that's a great resource for you to find any information out. Let me just have a look if there are any questions that I can answer. Thank you so much, everybody, for listening. I hope that it's been helpful and that it's informed you on the first trimester, signs that you might be pregnant, and what to do when you get that positive pregnancy test, what happens in your booking appointment, when you're likely to see your midwife, what happens at your first scan, all the blood screening that we're doing, any offers of Down syndrome, Edwards-Patel screening that we're doing, what's offered to you in your pregnancy, the junctures that you're likely to see your midwife and doctor, and all of that stuff. I hope that I've covered the things that you guys want to know from the first trimester. Obviously, this is based on an NHS hospital in the UK. So if you're from outside of that, your pathway of care might differ slightly, but it's something to ask when you do meet your midwife so that you know. Cool. Oh, there's one question on here. Third trimester. Oh, someone says the third trimester. Sorry, no, it's not. It's just a comment. So the third trimester, so probably not for me, but thank you for running. It's my pleasure. It's been an absolute joy. Thank you, everyone, for joining me. If you do have any questions, pop them in the comments. I'll stay here for a couple of minutes, just in case anything comes up. And the last thing to just remind you of, in case you forgot, is that if you've joined the masterclass with me today on the first trimester and early pregnancy, then you can get a discount code, 15% on any of the Positive Birth Company packs. So if you were thinking of buying the hypnobirthing pack, pregnancy pack, postnatal pack, anything like that, and had your eye on any of them, now's the time to buy. You get 15% off, and it only lasts for 24 hours. So go, go, go. The code is pregnancy15, capitals, pregnancy in capitals 15, and that will get you your money off any of the packs. Cool. I'm just going to sit here and drink my cup of tea for a minute or two, just in case any questions come in, and then I will head off. It's cold now. Oh, well. Such is life, especially when you're a mum. If you guys do have any questions, but don't necessarily want to ask them right now, the Positive Birth Company has an Ask the Midwife session every Thursday. Shahida does one week, I do the next week, and so you can always ask us questions on there. We put it out to the community, and we'll answer specific questions on there, anything that's popped up, anything that you want to know. So there's always someone to answer them. And also, in buying these packs, if you do purchase any of them, you get a free appointment with either myself or Sarah, and we can have a 15-minute one-to-one, just us, and go through anything that you might want to go through. And that can be really detailed and specific to your pregnancy. So if you feel like that might be helpful to you to have a 15-minute one-to-one with myself or Sarah, and you're thinking of buying a pack, then, you know, there's the potential for that, for answering questions as well. I missed the start, sorry. Am I okay to do spin classes at 6 weeks pregnant? Yes, it's absolutely fine, provided that you have been exercising in the past and doing sort of high intensity stuff like spin. So we're the kind of general rule of thumb is to carry on as you are. So if you haven't been doing that much exercise pre-pregnancy, don't suddenly start doing absolutely loads because your body's just not used to it. If you do want to increase your exercise, start gently. Start with yoga, start with Pilates, start with things like that. Swimming is great, and just build up to higher intensity if you want to. But if you have previously done spin and you're used to doing really high intensity exercise, that is absolutely fine. Obviously, just avoiding any contact sports like rugby, jiu-jitsu, karate, anything like that. Not safe in pregnancy. Deep sea diving if you wanted to. None of that stuff is safe in pregnancy. And also being really careful with anything where you might fall. So rock climbing, horse riding, things like that. I'm just going to skip one because it's not first trimester, and there is one about first trimester, so I'll just do that one first. Is it recommended that my partner should go to the very first appointment, the history, or is it not essential? If you can, that is great, just because we do ask about your partner's history as well, and we ask about their family. So we ask about your the baby's dad's mum and dad as well, so the baby's grandparents. We ask about their medical history, so it is quite in depth, and there is quite a lot of information to gather. So if you can have your partner there so that he can answer those questions, that is super, super helpful. And yeah, would be great. But if you can't, don't worry, it's not the end of the world. You can call them while you're in the appointment and ask any of those things, or give the information at a slightly later date, or quiz them prior to your booking appointment and get any information off of them, such as medical conditions that their parents have had, if there's any genetic conditions in the family, if anybody's had any hearing difficulties, if anybody's had any disabilities, those kind of things. So you can quiz your partner on those before, but if you can have them there, that would be fab. Okay, may I ask, I know it's not first trimester, but second trimester, what's the most important thing you can do to stay healthy, keep baby healthy? I mean, it's a combination of things. I don't think that there's one particular thing. I know that's a bit of a frustrating answer, but I think making sure that you're exercising in pregnancy, even if that's gentle because you're not that used to exercising, doing some kind of exercise is great for mental and physical health, and also eating a really well-balanced diet, as well as keeping yourself busy, keeping going, can be really good to maintain a healthy pregnancy. But there's not one particular thing. So it's just really about a healthy lifestyle in order to maintain a healthy pregnancy. Fab, I think that's it in terms of questions. Thank you so much, everybody, for joining. It's been completely my pleasure. I absolutely love working for the Positive Birth Company. They're amazing, and it's a delight to be here. So thank you so much for everyone joining, and I will maybe see you in the next one if they don't sack me after this. Hopefully they won't. All the best, guys. Have a good evening. Bye.